and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Today we are going to be talking about hypertension. Why is hypertension known as a silent killer? I know all of us have been hearing about hypertension this, hypertension that. Today we are going to be talking about what is hypertension, the types of hypertension, the causes of hypertension, the pathophysiology, nursing management, pharmacological management, and also the complication of hypertension. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be talking about hypertension. What is hypertension? I know a lot of us must have been hearing this word hypertension, hypertension, hypertension. And whenever we are asked what is hypertension, we use the word, we use the phrase or sentence, hypertension is an increase in the blood pressure above 140/90 milligram mercury. But is that true? Hypertension is not just an elevated blood pressure above 140/90 milligram mercury. There are some words you ought to take note of. When your patient visits you for the first time and you check this patient's BP and it's above 140/90 milligram mercury, you don't jump into conclusion and say your patient is hypertensive. For you to say your patient is hypertensive, the blood pressure must have been checked over time, consistently, persistently, and over time when you check, you find out that, oh, whenever I check this patient's blood pressure, it's always persistent. So most of the times when in a hospital, when you check a patient's blood pressure or during history taking, you ask, are you hypertensive? Are you a known hypertensive patient? Because with just one check, you can't really say your patient is hypertensive. So then that takes us to the definition of hypertension proper. Hypertension is the persistent, sustained elevation of blood pressure, usually above 140/80 milligram mercury. Take note of those words, persistent and sustained. It's what? A persistent, sustained elevation of blood pressure. For you to say your patient is hypertensive, or for you to say your patient has hypertension, the blood pressure has to be what? Persistent and sustained when checked. You get? So that blood pressure is the pressure exerted on the walls of the blood vessels. Blood pressure is the pressure exerted on the walls of the blood vessels. Whenever you see the blood vessels, I want you to picture a pipe. You know, a pipe that water flows through. You get? So when you say blood pressure, it simply means the pressure that fluid, that water exerts on the pipe. So that's the same way our blood exerts pressure on the blood vessels. So blood pressure is simply the pressure exerted on the blood vessels. You get? And blood pressure equals cardiac output multiplied by peripheral resistance. Peripheral resistance. Cardiac output multiplied by what? Peripheral resistance. Why? Cardiac output equals to heart rate times stroke volume. Heart rate multiplied by what? Stroke volume. Then that takes us to the types of hypertension. There are basically two types of hypertension. We have the primary hypertension and the secondary hypertension. The primary hypertension is also known as essential hypertension. The primary hypertension is also known as what? Essential hypertension. There's something peculiar about this primary hypertension in the sense that the cause of primary hypertension is unknown. It is idiopathic. You don't know what is causing it. But there are predisposing factors to this what? To this hypertension. There are risk factors to this hypertension, but you don't know the exact cause, what is really causing it. That is why it is primary. So some predisposing factors of primary hypertension is aging. When someone is getting old, that person is predisposed to developing what? Hypertension. Then the other is race. For the black people, we that are black, we are predisposed to go down with what? Hypertension. Then gender, the females are more predisposed or at risk of developing what? Hypertension. Then family history. For those that have it in their lineage, they'll tell you, your father has it, your mother has it, do your brothers have it, your sisters have it. So if you have a family history of hypertension, there is a possibility that you are going to go down with hypertension. Then obesity. For those that are very, very fat, obese, they are predisposed or at risk of going down with hypertension. Sedentary lifestyle, high dietary intake of sodium or saturated fat. For those people that like too much salt, too much sodium chloride in their food, they are likely going to go down with hypertension. They are at risk of going down with what? Hypertension. Then the other one is excessive caffeine, alcohol or tobacco use. For those that take excess alcohol, for those that take caffeinated drink, excessive of them, for those that take tobacco, you are at risk of developing what? Hypertension. Then the other types of hypertension we have is the secondary hypertension. The secondary hypertension is as a result of other things happening in the body. It can be as a result of renal disease, when the kidney is not functioning well. Somebody can go down with hypertension. It can be as a result of Cushing's syndrome. It can be as a result of pregnancy. We have pregnancy-induced hypertension. It could be as a result of diabetes mellitus. It could be as a result of thyroid, parathyroid gland, or pituitary dysfunction. All these are the types of hypertension, and all these are also the causes of hypertension. That takes us to the pathophysiology of hypertension. Let's talk about the pathophysiology of hypertension. Do you know what happened in the pathophysiology of hypertension? Those causes that you are seeing, aging, all those predisposing factors, those causes, what they do is that there's a stimulation of the vasomotor center of the brain. There's stimulation, they go there to stimulate. And when that vasomotor center of the brain is stimulated, what follows is that there is release of acetylcholine, epinephrine, and non-epinephrine. First thing is that there is stimulation of what? The vasomotor center of the brain. And when that vasomotor center is stimulated, it leads to the release of what? Epinephrine, non-epinephrine, and acetylcholine. And you know what the function of these things are? They help to constrict vessels. They are vasoconstrictors. They help to constrict the blood vessels. So when this is released, it leads to vasoconstriction. Let me explain this. Remember, we are using the pipe as a blood vessel. For example, the normal pipe now is a blood vessel. All of a sudden, there's constriction. You press that pipe. The pipe is now small. It's not narrowed. It's not constricted. Definitely, the pressure with which normal water will pass through that pipe, you see the water passing through the pipe with pressure, like with force. I don't know if you get now. Let me explain it again. A pipe. For example, there is a pipe. Water is going through that pipe. All of a sudden, this pipe is now narrowed. It's now constricted. What will happen is that water will be passing through that pipe with force. That's also what happens between the blood and the blood vessels. When those vasoconstrictors are released, the blood is now passing through that pipe with high resistance. There's increased peripheral resistance because the blood is trying to pass. But because of that constriction, because of that resistance, the blood is unable to pass perfectly well. So there's vasoconstriction, there's increased peripheral resistance. You know it's not passing. Then there is now resistance. There's increased peripheral resistance, and because of that increased peripheral resistance, there's increased blood pressure. Remember, we talked about blood pressure is equals to what? Heart rate multiplied by what? Peripheral resistance. So when the peripheral resistance is increasing, the blood pressure is what? Increasing. So there is increased what? Blood pressure. When there's increased blood pressure, the body notices. So there's this compensatory mechanism of the heart comes into play. The heart is trying to say, oh, let's see how we can make it out to see that everything is in order. So what happens is that the heart rate also increases, and cardiac output. The heart rate what? Increases, the cardiac output increases. And there's what? Hypertrophy of myocardial tissues. When you say hypertrophy, you simply mean increase in the size of the cells. Increase in the size. So there's hypertrophy of myocardial tissues. The myocardial tissues, they are increasing in size. That's that hypertrophy. They are hypertrophy. So when that happens, there might be tiny blood vessel rupture to cause epistaxis and also retinal damage. Because all these blood vessels, there is resistance to the blood flow. So it can actually result in retinal damage, that's the eye. Then it can result in stroke due to this rupture, the blood vessels that rupture. Remember, stroke is an alteration of the blood flow to the brain. So there can be epistaxis, there can be retinal damage, and there can be cerebrovascular accident, which is CVA, sorry. There can be cerebrovascular accident, which is stroke. So this so-called process, what it does is that leads to the occlusion of blood vessels. There's what? Occlusion of blood vessels. And when there is occlusion of blood vessels, there will be reduced blood to vital organs. There will be what? Reduced blood to vital organs. One thing I want you to note is the fact that there's vasoconstriction of the blood vessels, and that vasoconstriction leads to what? Increased resistance, increased peripheral resistance to blood flow. And that increased peripheral resistance leads to what? Increased blood pressure. That results in the various signs and symptoms we see here. The first is headache. Then the second is epistaxis. Before I go into details, hypertension is known as the silent killer. Why? Most patients, they don't normally know that they are hypertensive or they have hypertension. Their blood pressure will just be on the high side. They won't even notice. You get, till they visit the nearby facilities or till they go to the hospital. That is when they tell them, your BP is high. They'll be like, shocked. Are you serious? I am not having any signs and symptoms. Most of these signs and symptoms comes up when the patient's like, the BP is not extremely high, then there's a lot of changes going on in the body. You get, hypertension is known as a silent killer because most people that have hypertension, they don't know until they visit the nearby facility. That's why you can see people, they sleep and don't wake up or something like that. So, signs and symptoms of hypertension include headache. The person will be having headache because of the pressure around those blood vessels. There will be epistaxis. There will be elevated blood pressure when you check using your sphygmomanometer. Sleeplessness. This person will be having insomnia, fainting, like that feeling of dizziness. Then there will be chest pain. There will be dyspnea. Dyspnea simply means difficulty in breathing. There will be oliguria. Oliguria simply means urinary output, reduced urinary output. Let me explain how this oliguria comes in. When there is reduced blood flow to the kidney, you get, there is going to be reabsorption of sodium and water. The body will be reabsorbing more sodium and water. So there will be increased fluid in the body. And a reduced amount will be going out. The person will be passing enough urine out. There will be increased fluid in the body. And there will be reduced urinary output. There's oliguria. There's weakness. There's dizziness. And also there is what? There is confusion. Then that takes us to the management of hypertension. Now let's talk about the management of hypertension. The aim of management is to reduce the blood pressure in order to prevent complications. The aim of management is to what? Is to reduce hypertension in order to prevent complications such as cerebrovascular accident, popularly known as what? Stroke, retinal damage, and also renal insufficiency. Most patients, most complications that I've encountered in my clinical settings are actually stroke. So the major aim of hypertension management is to what? Is to reduce the blood pressure, to bring the blood pressure down, so that complications such as stroke, complications such as retinal damage, and also renal insufficiency will not occur. The management cuts across the use of various group of drugs and modification of lifestyle. In the management of hypertension, it's not only drugs that is involved, both drugs and lifestyle. We have the pharmacological management. We also have the lifestyle management. For example, a patient that smokes should reduce smoking or should stop smoking totally. A patient that take in excessive fatty food should reduce it. Also, a patient that drink alcohol, caffeine, that takes a lot of caffeine should reduce it. Also, a patient with hypertension should reduce their salt intake. That is also part of the lifestyle modification alongside with what? Pharmacological management. In terms of the pharmacological management, which is drugs, the first one I have here is the diuretics. I believe most of us are familiar with diuretics. For those that are not, I'm going to tell you what diuretics are in simple terms. Diuretics helps to increase urine output. It makes maturation, increase your passing out of urine, so that there will be reduced fluid, there will be reduced sodium, reduced water in the body. So that's what diuretics do in summary. So examples of diuretics that can be given are, we have furosemide. I know most of us have heard about it, furosemide. It's another name for furosemide is Lasix. Lasix. Then we have a chlorothiazide, thiazide, and also spironolactone. These are diuretics that can be used for hypertensive patients. Then in other pharmacological management, we have the adrenergic blockers. We have what? The adrenergic blockers. Remember in the pathophysiology, we said that the vasomotor centers are being activated. And when they activate, it leads to the release of what? Your adrenalines and your non-adrenalines, or the epinephrine and non-epinephrine. So what that does is to constrict the blood vessels. So when you give adrenergic blockers, they help in a way to reduce the outpouring, or how will I put it now? Okay, it helps in a way to reduce the epinephrine, or to stop the epinephrine, or to reduce the epinephrine and non-epinephrine in the body. That's why they are adrenergic blockers. They block adrenaline. They block the adrenalines. And examples of these adrenergic blockers are your methyl dopa. Methyl dopa, popularly known as Adomet. Like Adomet is the common name. Methyl dopa, we have labetalol, we have nadololol. So these are adrenergic blockers. They work with epinephrine and non-epinephrine. They block their release so that they will not be released, so that they cannot cause vasoconstrictors. Then we have the vasodilators. These vasodilators help to dilate the blood vessels. You know, the blood vessels are constricted. So vasodilators help to what? They help to dilate the blood vessels. An example of vasodilators are hydralazine, hydrochloride, and also nitroglycerin. These are examples of what? Vasodilators. Then another one is angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors. What this does is that they inhibit the conversion of angiotensin. They inhibit what? The conversion of angiotensin. An example is captopril. Anywhere you see pre, what should come to your mind is angiotensin converting enzyme inhibitors. We have the captopril, lisinopril, and we have the ramipril. Then another class of drugs used in the management of hypertension is angiotensin II receptor blockers. As the name implies, it blocks angiotensin II receptors. Those receptors that are to receive angiotensin II, it blocks them. So anywhere you see Satan, what comes to your mind is what? Angiotensin II receptor blockers. For example, your losartan, your valsartan. Then another is the calcium channel blockers. These calcium channel blockers helps to block calcium channel, as the name implies, simple. Then examples are amlodipine and nifedipine, and also felodipine. Anywhere you see pine or pin, you know it's calcium channel blockers. Then that takes us to the nursing management of hypertension. the next thing we're going to be talking about is the nursing diagnosis for hypertension. What is the nursing diagnosis for hypertension? The first one we have here is ineffective breathing pattern related to increased vascular resistance evidenced by dyspnea. There can also be decreased cardiac output related to increased vascular resistance. Then the other one we have is acute pain, which is usually headache. These patients usually have occipital headache. So we have acute pain, headache, related to cerebral arteries constriction, evidenced by patient's verbalization. Then another nursing diagnosis we have is deficient knowledge. Deficient knowledge related to the cause of the disease. Deficient knowledge related to the cause of the disease, evidenced by patient asking too many questions. We can also have anxiety. We can also have imbalanced nutrition more than body requirements, especially for the obese patients. So these are the nursing diagnoses associated with hypertension. Then, in terms of the nursing management proper, using the acronym ApoDeseral as a guide. For those that don't know about that, you can send a message to us on WhatsApp so you can get a voice note on what ApoDeseral is all about. Using ApoDeseral as a guide, these are the key points that should be associated with our nursing management for hypertension. The first one we have is the vital signs. But before vital signs, the first thing as a nurse, before any other thing, is to assess the patient, is to take history from this patient, is to review previous records of this patient. So proper assessment is very, 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 very important when it comes toward hypertension. Then after that, we have the vital signs now. The vital signs records, the vital signs taking, it's very, very important in the sense that you have to take note of the respiration rate to know if this patient is having dyspnea, to know if this patient is having difficulty with breathing. You have to take note of the pulse rates. You have to also take note of the essential vitals such as your blood pressure and also your temperature. This should be taken regularly so we can detect deviation and any abnormality associated while treatment is ongoing. Then the other is nutrition. For the patients with hypertension, it is advisable that they reduce their salt intake. They reduce what? They reduce their salt intake. They reduce their intake of saturated fats. It's advisable they reduce their intake of fat. It's also advisable that these patients reduce their tobacco intake, reduce alcohol intake, reduce caffeine intake. If possible, they should stop the intake of tobacco, caffeine, and alcohol. Though it's going to take some time to actually withdraw from it totally. So they should stop all that. Then the other is physical care. That patient should be involved in both active and passive exercise depending on the strength, depending on the capability of the patient. Stress should be limited. It's also very important for us to limit the stress this patient pass through. Then also, if there is epistaxis, which is bleeding from the nose, an ice pack could be placed at the ridge of the nose to constrict the vessels and help stop bleeding. Then the other is monitor adverse effects of drugs. We all know that all drugs have their own side effect, they have adverse effect that you have to take note of. So when you take note of this adverse effect and a patient's reaction to these drugs, you take note of it, inform the doctor, and carry out your dependent role as a nurse in regards to the adverse effects of drugs. Then the other is client and family education. When it comes to hypertension, health education is very, 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 extremely very important because most patients, they are not aware of the causes, the predisposing factor, the risk factor of hypertension. So it's a duty as a nurse to health educate this patient and their relative on hypertension. You health educate them on the need to stop the intake of caffeine. You have to educate them on the need to stop the intake of alcohol, the need to stop the intake of tobacco, the need to reduce their salt intake, which is sodium chloride, the need to also reduce their intake of fatty food. This is part of the education you are going to give your patient. You are also going to educate this patient on regular blood pressure assessment or checking of the blood pressure regularly. This patient should be encouraged to have their own digital sphygmomanometer so that they can easily check their blood pressure regularly and observe for any deviation. The signs and symptoms of increased blood pressure, such as increased headache, hospital headache, difficulty with breathing, should be communicated to them, so they know what to do at a particular moment. They should also be advised to visit the hospital if they notice anything abnormal that they can't really handle. That is that about the nursing management. Then also that takes us to the complication of hypertension. When it comes to the complication of hypertension, the first one I have here is myocardial infarction. Myocardial infarction is simply the death of the muscle layer, the death of the muscle of the heart. So that's myocardial infarction. Then we have retinal hemorrhage. Retinal hemorrhage has to do with the eye, the retinal artery. Then we have renal insufficiency. That is, the kidney is not getting enough nutrients. The kidney is not getting enough blood supply. The kidney is not sufficient because of what? Hypertension. Then we have stroke. Stroke, which is popularly known, stroke is also known as cerebrovascular accident. Cerebrovascular accident is more or less like a cut of blood supply to a particular area in the brain. Then we have heart failure, then we have blindness. That is all for our lecture on hypertension. If there is any question, kindly drop on the comment section. If there is any contribution you would like to make, or if there is any video you would like us to prepare, kindly drop on the comment section. Don't forget to like, don't forget to share if you got value. Thank you and have a wonderful day ahead. See you in our next class.